Assalamu alaikum. मेरा नाम Dr. Shahid Latif है. I'm a consultant psychiatrist and a clinical director working in the NHS in the UK. I've been a psychiatrist for over 20 years. I'm a graduate of Rawalpindi Medical College, a proud graduate. World Mental Health Day or Awareness Day fell on the 10th of October 2021. Har saal, it's on the same day, and it's an opportunity for people like myself and my fellow colleagues and professionals, including all doctors, to raise awareness of the importance of mental health. Mental health, particularly the common mental problems like depression and anxiety, affect 1 in every 4 people. That means if there are 4 people, 1 of them will develop depression or anxiety sometime in their lifetime. This is extremely high. Depression is a clinical entity, just like any other physical health problems like diabetes or cardiac problems or rheumatoid arthritis or high blood pressure, etc. Similarly, clinical depression, anxiety disorders are clinical entities. By clinical, it is meant that some of the chemicals in the brain, the dimaag ke andar, they do go slightly unstable and they require maybe medication, but definitely some form of talking therapy, whether it's counseling, therapy, psychotherapy, etc. Mental health, when we consider, doesn't necessarily mean mental illness. Because we have our physical health and we can experience headaches or tummy aches, that doesn't mean that we are experiencing something serious or a disorder. Similarly, because we carry our brain with us all the time between our 2 ears, of course we will have our own mental health. And with our mental health, we do carry our own emotions. Sometimes emotions can get the better of us, and if they are too consistently negative, they can become like a baggage on our shoulders. And these can ultimately lead to symptoms of anxiety and depression. That's why it's really, really important that these are picked up early. And it's not necessarily that intervention would be required, but just to be conscious and to manage them at an early time. So let's take this day and every day as raising the awareness and doing away with the stigma which comes with mental health. I know as Muslims, we do believe in the concepts of nazar and jadoo and black magic and jinn possession, etc. But we have to remember that mental health is something very different from this. There are chemicals in the brain that do respond to medication treatment, that do respond to talking therapy. So everything is not necessarily a superstition like jinn possession or nazar or jadoo. So this is something we have to tackle. That doesn't mean that we must not utilize the power of our religion, of Islam, by reciting things from the Quran, etc., by contacting and talking to our faith leaders, etc. But it also means that we should also seek medical advice. Look after yourselves, and I hope you have a wonderful day. Assalamu alaikum.